Here at WellCare, we've created community impact councils. Through those, we've been able to truly impact the health equity and overall health of the communities that we serve. We analyze data from all 120 counties to figure out what are the individual needs of those counties, and with that data, we meet with community leaders and community partners. What we have found with the community impact councils is we're really able to drill into the individual needs of each county of the state.
We are here at NKU for the 2023 second annual Northern Kentucky Youth Summit. We are here today to talk about a very important topic, which is suicide prevention and empowering young mental health champions. So we're here with over 21 schools, over 200 middle and high school students across Northern Kentucky.
It's okay to share your mental health. It's okay to stand up for yourself because it's important and it should happen.
So WellCare was very instrumental in starting this Community Impact Council, as well as being our key sponsor for the event, and have been carrying forth this Community Impact Council across the state, so not just in Northern Kentucky, to really provide some more support for our young people that really need it at these moments.
There are a lot of challenges that people who are deaf or hard of hearing or have hearing loss have getting access to health care. The Department for Behavioral Health, Developmental, and Intellectual Disabilities, or DBID, was invited by WellCare to join into a Community Impact Council about 2 years ago. And what an opportunity to come together, not just to talk about problems, but to generate solutions together. So over the course of multiple meetings, we were able to narrow it down to focusing on access to care. When we talk about access, it's about communication. So does a person have access to an interpreter? Or if they're not a sign language user but they have hearing loss, is there adaptive equipment available? If we have outcomes related to WellCare providers being more informed and knowing what they can do to provide communication access, that is really key.
Through our community impact councils, we're beginning to see a ripple effect. In Western Kentucky, when analyzing the data through the council, we saw there was a need for daycares. Working with those partners, we were able to help get funded a daycare, and through that, 2 surrounding communities are doing the same.
Daycare is a significant issue for this part of the state. We have been determined to be a daycare desert. For every slot that is available, there are 6 kids waiting.
A WellCare representative reached out to us, said they had some funding to help us out and get this council put together to identify some problems in the area and kind of come up with a focus. From there, we narrowed it down to childcare. One, we knew it had to be affordable. 2, we needed a lot of slots. What we did was first started looking at who could operate a daycare. After we figured out that there was a daycare up and running in our sister city in Tennessee, they were willing to come on this side and run one. We were able to write a grant and get funding for one in Hickman, and then also Clinton, which is in Hickman County, wound up getting a grant as well.
They was concerned about the community. They were concerned about us. Within a year's time, we have able to start 3 daycares in Fulton, and it's because of the initiation of the help from WellCare.
One of the things that I saw when I came on board as president was the culture. It is palpable, you can feel it. They are truly passionate about serving our members and taking care of them where they are. Through the Community Impact Councils, which is an idea that the team came up with, we are truly able to go in every individual community within the state of Kentucky and make a difference.